Great. Welcome back to another podcast. And we've spoken to this gentleman before. He's been about running around the country, not only the country, the continent, for all matters basketball. He is very, very integrally linked with wheelchair basketball here in South Africa and across the African continent. And as a result of that, is also highly involved in all matters basketball, essentially, across the continent. And the reason we're talking to him today is he has just recently come back from the inaugural BAL tournament. And when I talk about BAL tournament, I'm talking about the African Basketball League. Now, for those that don't understand the African Basketball League, this was an initiative put together about 2 years ago as a partnership between FIBA and the NBA. And the whole idea was to build this sort of, or create an initial league outside of North America, outside of the home of the NBA. And like I said before, no stranger to our discussions around basketball. Charles Saunders, welcome back. Thanks for your time on this very, very chilly Friday morning. You just recently come back from Rwanda in Kigali, where you initially went there for a couple of scrimmage games and then stayed there for the entire duration of the BAL tournament that finished off on the 30th of May. As I said, welcome. Thanks for your time. And hopefully we're going to dig a little bit deeper into all of this BAL action.
Yeah, absolutely. And thank you once again for this invitation. Much appreciated as usual. So yes, the terminology wheelchair basketball and running basketball, I think that's the easiest way to explain it. Okay. Yeah, I've been very privileged, and I must say that I've not only involved in wheelchair basketball on the African continent and throughout the IWBF world, but also involved in FIBA basketball in Africa and the outside of the continent as well. And very privileged again that I was approached by the Basketball Africa NBA and asked whether I'd like to be involved with the Basketball African League. Now, as you alluded to, the Basketball African League was actually a spin-off from what was called as Afro Basket Club Championships. And the club championships ran for a period of 5 years. Well, it's been running since the early 1950s, but for the last 5 years, they created a new type of program where it involved windows, and from windows was qualification, from qualification, top four, and then a final set of games that took place in Angola. The whole idea behind this was quite simply that we needed something on the African continent that would boost not only return of income, but most importantly, the image. And this was an agreement that took place between, as you said, FIBA and the National Basketball Association, which is the NBA. And the idea behind it was to create a club championships recognized in countries where the NBA had set up offices. And of course, because of the COVID and because of bubble requirements, this time it didn't travel around the continent as what was expected, although certain windows took around the continent in the qualifying processes. But quite simply, it ended up in Rwanda, and Rwanda actually put on one of the most magnificent shows that I've ever seen. Well done to them, and well done to the government, and well done for actual sports ministry support behind the whole program. What an incredible tournament. 12 of the top club teams in Africa, all who took a period of around about 4 or 5 months in qualification process through windows throughout the zones, and the 12 top teams then selected and to represent Africa in the first, or the inaugural, Basketball African League. The terminology BAL is no longer utilized, and the acronym is now quite simply Basketball African League.
Charles, looking at those initial 12 teams, they obviously represent the initial 12 countries.
Yes.
Looking at those countries, Algeria, Angola, Cameroon, Egypt, Madagascar, Mali, Morocco, Mozambique, Nigeria, Rwanda, Senegal, and Tunisia. Obviously, as a South African, a notable exception is us, the South Africans. Obviously, like you said, there were some window tournaments, there were some qualifications, and South Africa just didn't quite make it into that initial top 12.
Yeah, unfortunately, the Basketball South Africa's house hasn't been in order for a while now. And at that given time, when the actual launch of the competition took place, there was still quite a bit of forensic investigation taking place within the organization. And BSA was not in a position to really and truly be prepared for this type of tournament. A little bit sad because the home of the Basketball African League, or the home of NBA Africa, is situated in Rivonia, Gauteng, and a little bit disappointing that we couldn't be one of the host countries, as in representing the home of NBA Africa. So, end of the day, I do think their house has been sorted out now with all the forensic reports and submissions through to government and so forth, and that's for another discussion. But quite simply, South Africa will now host one of these windows that will take place later on this year, and in September, and hopefully that by this given time, the club program within South Africa will be sorted out. Again, limitations and COVID expectations. But right now, what is actually happening is around the country is a whole lot of windows taking place where all the provinces are running their competitions, and the champions of those provinces will go through to South African National Club Championships, which should take place between August and September, and finalize this whole particular program before the end of September, which would then go into the window where Zone 6, in other words, the 11 countries that are situated in Zone 6 will then participate, and there should be a winner that then goes through and represents the Zone 6 within the African continent.
Okay,
so it's a large process that takes place before one gets there.
So not all doom and gloom. South Africa are currently going through those processes, but a key thing in chatting to you before this discussion is obviously, as you've mentioned, COVID. COVID has had a major impact on the sport, as we spoke in our last discussion. It also had a major impact on this particular event in Rwanda in terms of the bubble situation that needed to take place. You spoke last time about how many of the African countries have developed these bubble programs, and successfully so put them together. How did this particular event compare to the previous event that you were at, where, as you spoke quite well about how well it had been managed? How do you compare the two in terms of how they put together their bubble programs?
Yeah, look, the NBA is under huge amounts of restrictions, especially from the safety of the individuals that participate in the competition. And of course, a lot of the protocol comes directly out of New York, and that's quite simple, that you go into this 7-day lockdown period where you are tested for a period of 7 days, all negative. Once you get all your negative PCRs, which is your COVID testing, you are then allowed out of that particular isolation bubble and into the mainstream bubble, which is the competition bubble. In this particular respect, the competition was over a 31-day period. It wasn't something that a FIBA competition is run by. FIBA competition, your PCR tests are all taken place prior to arrival, and then during the actual competitions, you're tested, but your quarantine period is not as extensive as what the Basketball African League required. And because of being an area where many of the teams that were coming through were hotspots or COVID hotspots, they couldn't take any chances. And I felt that although it was a long period of time to be in isolation, a long period of time to be in a bubble, it was well managed, well taken care of. I mean, there was no time when those that were inside the bubble were not able to be on Zoom calls, learning Zoom calls, e-learning Zoom calls. The referees, for example, which was part of the program that I was with, called referee supervision or referee operations, was required to attend up to 3 webinars a day with referee analysis and referee learning. So from that point of view, very encouraging. The morning sessions took place where it was a fitness program taking place within each room, very well coordinated, very well organized. So although you weren't allowed out into public, and when I say public, I'm talking about the bubble, you weren't allowed out into the actual sport bubble, everything was taken care for you whilst you were in the isolation period. So from that side, commendable and extremely different from anything that I've attended anywhere else in the world. Of course, extraordinary circumstances.
Yeah, if I recall the last discussion we had, you mentioned a lot of the players expressed their frustration being stuck in a room for 7 days prior to even being able to properly stretch and warm up and really get the feel of the court and get the feel of a ball, because it's very, very difficult being stuck in a 6x6 room with a bed and a bathroom and maybe a TV and stuff with only limited number of channels. Yes. Now, from what I gather from what you're saying is that those learnings have come forward into these tournaments where there's a lot more physical activity, there's a lot more interaction with these players while they're stuck in the bubble, so they feel less like they are left alone until the day that they're allowed out.
Absolutely correct. It was from this point of view. Look, the NBA ran it when they started off the National Basketball League, and the whole idea behind it was to ensure that everybody was inclusive with everything. But not only that, there was a whole lot of marketing that was built around it. All of the workshops that were attended was not only learning workshops, it was interactive workshops. It was, of course, during a time period to identify, if I can turn around and say, women within sports. It was identification on a child protection program. It was awareness. It was a lot of interactiveness and discussion that took place. And it was very good because you had opinion not only from a particular sector, but opinion from every sector across Africa, and different cultures, different languages, and different inputs. And it was actually excellent. For me, eye opener, and something that can be integrated in any sport structure. If we are holding a world championship in a bubble or holding a qualifier or whatever the case may be, I think that the way they went about it was very, very well constructed, very, very well marketed.
So, Charles, in terms of those learnings, I know looking at your calendar from a wheelchair basketball perspective, your first events are at this point in time scheduled to take place end of July. A lot of those learnings that you've picked up at this international level, how much of those learnings have you come back and brought into the basketball structures here within South Africa so that we pick up from these international sort of cutting edge, top level experiences and make sure that we are taking those experiences and letting our players, because I think at the end of the day, and I suppose this is where the question is going, a lot of these players will ultimately find themselves playing at these international levels. So a lot of those experiences, if they can understand them and experiencing them here, when they go overseas and experience them there, they're not new. It's something that they're accustomed to, and it doesn't sort of set them back and go, well, how do I deal with this?
Yes, yeah, absolutely. Look, it's each country has their own resumption policy, and that is something we need to take into consideration. So within South Africa, we have the sports ministry and the health ministry that determine what takes place in our country. Okay, Rwanda has a different particular policy. They allowed a certain capacity to be within their stadiums as long as those individuals were recognized that they were COVID-free. And all of this was done on a national platform, a national app, where you had to download and upload it every single day. And when you showed your 3 negatives, you were allowed to come and be a spectator within the sport. Of course, they followed the guidelines, which was social distancing, the number of people, capacity within a stadium. But what was great about it was there were spectators in the stadium. And this is something that I haven't been able to understand about South Africa, why they haven't adopted and learned what the rest of the world are doing and how they're doing it. Because the app is very, very simple. It's a downloadable app, and it is monitored within the health ministry and or within the organization that has set up a COVID compliance officer and a medical commission, and people are then monitored accordingly. It is not a difficult process to take place. I have a look at the empty stadiums with the Springbok rugby and the Curry Cup and the cricket and so forth. And I start asking the question, why? When there is a platform and platforms that can allow spectatorship. It's just organization. But that's my little rant for the day. Apart from that, this is what Kigali did, and I see that a lot of other African countries are following suit as well, and they're allowing X number of spectators within their premises as long as those spectators are COVID-free. Now, the fact that they've done the rollout on the vaccination process, that makes things a lot simpler and a lot more easier to get people into stadiums. This was something that was needed for such a prestige competition. They needed to do something, and I have to applaud the Rwandan government in their foresight and their understanding of how to manage something like this. They tried it several months prior to the program in one of the FIBA windows. It worked out very successfully. They tried the same thing within Cameroon as well, a little bit more difficult on controlling that system, but it works. And the fallout of COVID infections because of crowd gathering was well controlled, and monitoring what was happening inside the country, very, very little. In fact, zero effect on the way that they handled it with the fallout of COVID in that particular spectator pool. Again, everything was done within a bubble. So all of those that attended and watched the games had to ensure that they met the criteria of COVID-free PCRs before, or COVID-free testings before they were allowed into this particular bubble. And then by cordoning off areas where spectator was not allowed anywhere near player, and player was not allowed anywhere near any other aspect, as well as technical officials were not allowed any further than a particular zone. This controlled everything. The cleverness of putting delegates into a particular hotel that were only allowed into a particular zone, players into another hotel which were allowed into the player zone, and then officials in another hotel which were allowed only in the official zone, kept everybody free and non-contact with one another, which also stopped it. So if we can just take into consideration that there was an average of about 460 people within this bubble, with all the teams and everybody involved, and there was testing that took place for 31 days, at an average of $60 a test.
Wow.
Where within a period of 12 hours, you had your results put forward on a platform that came back to you. Those results came through from the Testing Institute, which was then uploaded onto another platform, which went into the organization's controlling mechanism. And anybody that turned up with a negative PCR test was then allowed to travel from one point to the next point, but only within the bubble. Those that turned up with a positive aspect were immediately isolated, had to produce 3 negative tests, and then were released again out of that particular isolation setup. Out of everybody being tested for 31 days was one positive. That is how controlled this whole thing was. Only one.
Wow.
Only one. And that was absolutely incredible. And that was from people traveling into the bubble at a later stage when it came to the semifinals and finals programs. It resulted really and truly, I can't praise them enough for what they've said or what they've done. It was well orchestrated. Okay. And this is something that FIBA does as well.
Okay, but
I must say that FIBA, yes.
Here's the big question.
Sorry, carry on.
You've been back in the country just over a month, okay, since the end of that particular tournament. Now, as you said, it's a prestigious tournament. I mean, here we're talking about the very first league in conjunction with FIBA and the NBA, outside of the traditional NBA sort of a foothold, which is North America, the United States of America. In the month or so that you've been back, you mentioned earlier Department of Sport, Department of Health. Have you been in contact with any of them to relay these experiences, to unpack the learnings that you've picked up, to be able to bring all of that here? Or are you still waiting on them? Or, I mean, has any of this stuff gone into sports here in South Africa, is what I'm trying to get at?
Yeah, the matter, as myself that sits within the actual wheelchair structure, and I sit as a member of Basketball South Africa, it's reported through to our compliance officer. We've appointed a compliance officer within Basketball South Africa that oversees all competitions, basketball competitions within the country. And these reports have gone through to him. He has expressed the reports and sent through. And we are minor in comparison to the size of rugby, cricket, soccer. Okay, and all of them have also gone ahead and also kind of discussed the same things that we are discussing, because we can see it when we go and compete in competition outside South Africa. We can see it when we compete in FIBA competition and CAF and so on and so on. The reality is I don't believe that we are set up as a country, which is quite sad, within our governmental departments to be able to manage this. I think that's where the failure is. And because of it, they rather stay away from it. There's also a problem is that we are a very indisciplined society. If you go ahead and you turn around and say and let me be careful how I say this, but let's just turn around and say for a Chiefs and Sundowns game, and turn around to people and say to them, sorry, you can't go into the stadium because you can't produce a COVID positive or negative test, we're going to have riots on our hand. Just having a look and seeing what's happening during this variant now, this Delta variant that has hit South Africa, it's not climbing by 1,000 people per day, it's climbing by 5,000 people per day. So although all the restrictions are in place, and government is trying not to shut down the economy, our people are so indisciplined.
Yeah,
they just continue to meet, they continue to gather, they continue to, they really and truly don't care. Okay, and the problem is that when it happens and family members are dying and friends are dying, then all of a sudden it's a problem for us. But we are our own worst enemy. We are just not complying to regulations. And I see it daily. I see it from a work perspective where our sites are getting shut down. Why are the sites getting shut down? Because we are just getting people that are going out at nighttime, socializing, attending whatever the case may be, coming back to work the next morning, spreading the virus, and next moment, 14 days later, you don't have work. Why? Because your sites are shut down. Yeah. Likewise with sport. How shocking is it that there are 12 members of the Springboks team that have just contracted COVID? Yeah. If you're in a bubble and you're in a secure bubble,
how's it possible?
Okay, that means that your hotel personnel, your drivers, your administrators, your management, your whatever the case may be, if your family members are with you, you are all in that bubble. You do not and cannot be exposed outside that bubble. So there's a fundamental problem here. And we have to turn around and say that I understand why government doesn't allow spectators into stadiums, because there is no discipline.
Yeah, yeah.
And people can have their say and comment on what they want to comment after this podcast, but that is the reality that we're facing with at the moment. And we can shout and scream and do whatever we want to do, but just comply. And if you're complying, everything will come through a little bit easier.
Well, I suppose,
truly believe this.
I suppose, Charles, your experience is showing, I mean, is literally explaining what you've just said now. I mean, you've just come back. I mean, in the last, 7 months, you've attended 2 international tournaments outside of this country. You've been exposed to hundreds of individuals from various quarters of the globe. And to my mind, there were hardly any, there were some, but there were hardly any relative to the number of people, positive COVID tests. So by sticking to the regulations, adhering to proper bubble protocols, it's very, very clear from your experience, okay? Please correct me if I'm wrong, that adhering to those proper protocols does allow for safe sports, and as you've just experienced now, with spectators.
Yeah, absolutely, absolutely. There's no two ends to this. That's the reality of it. Is stick and stay within the compliance regulations, and if you do so, it will work. Okay. The rollout of vaccines, whether you are a vaccine, what they call them, vaccineers or non-vaccinator. Okay. At the end of the day, is quite simply you need to prepare your body, because this disease is a concern for those that are suffering with underlying health conditions. It's clear. Okay, so whether you believe in taking ivermectin or taking the hydrochlorine or the other aspect,
hydrochloroquine,
the hydrochloroquine or the vaccine, which whether it's Pfizer, whether Sputnik, whatever the case may be, the realities is in my research to date, those that have taken the vaccine are still able to contract the COVID virus. The difference is it is a milder response than those that haven't taken it. Those that are taking ivermectin are creating a blocker and are less likely to contract the disease. But if they do, it's a lot milder than those that don't. So the realities is that when we go into these type of bubbles, and I've got a very heavy schedule this year. Not only I leave within another, what's the date now? The date's at 9th, 10th. In 20 days, I leave for Hungary at another World Championships. And the situation is that before I can leave now, I have to have my vaccine, and I have to prove that I have the vaccine. Otherwise, I'll go and sit in a 7-day quarantine when I arrive. Okay, the realities is that although the vaccine isn't a foolproof aspect, what it does allow me is to get out of a quarantine within 48 hours. Okay. And a more chance of being protected within that so-called bubble. This is the reality that talking to many of my colleagues within Europe and so forth, this is the reason why they can run their stadiums, because of the rollout of vaccines. South Africa is very slow at the moment, and it's a major concern on what I'm seeing when I go into the hospitals. You go to any of the government hospitals, they've got tents up with beds and tents with COVID patients just lying all over the place. It is a problem, and we're in a crisis in this country. We really are, and I can't express it more and more and more. Social distance, stay away from crowds, time your shopping, be careful with sport entities. If you are participating in anything of the sort, ensure that you are responsible. And this is something that was taught very much within Kigali. You are responsible for yourself. Okay, the emphasis was on you to ensure that you uploaded your results. It was a spectatorship that was stated quite clearly. You cannot come anywhere near the stadium unless you can prove 2 negative results. And this is just something very simple. Go out there, go get tested. I know it's expensive, 850 Rand a test. Okay, but your serology tests are going for 280 Rand. All right, go get a serology test, go get a rapid test, whatever the case may be. Okay, and once again, just comply to regulations.
Yeah.
I've been very fortunate. I've traveled not only to 2, but I've had a total of 5 international competitions during this COVID period. And all I've done is I've complied. That's all. And I'm okay today. All right, touch wood. But that's the way it is. And that's a message I can give to the public, is just be careful out there.
Well, Charles, thanks for that message. And from that message, let's talk a little bit, let's finish off and just talk a little bit about your schedule, the basketball schedule here in South Africa. Obviously, you sitting on the Basketball South Africa board, you obviously being right up there at the top of the Wheelchair Basketball Federation. what does basketball look like in this country? When are we opening up? When can fans, when can players expect to see, you know, the hoops being scored again here on South African soil?
Well, again, what we've done is within the Competitions Commission of Basketball South Africa, we have given an outline of when competition should take place and when it shouldn't. Restrictions and level lockdowns are something that is out of our control. But quite simply, there is a program that has been drawn up. We're dealing directly with provinces and districts and informing them quite clearly that under the resumption of sport regulations, please, by all means, continue, but impose upon every single person that is there that there is the temperature testing that's taking place. That if anybody is just with a runny nose, stay away from competition. Okay. Once again, we are trying to impose discipline on the individual himself and make him aware that just by him coming through with the snivels or with a cough or whatever the case may be, involved with his team could result in another 12 people being quarantined because of being reckless. All right. And this has really and truly gone down fairly well. I must say that the sporting public, a lot of these guys are professional in attitude. And what is good about it is they're fully aware that they can't afford to get sick, because they get sick, they lose their international contracts and they can't play and they can't do. And this was something that came out very clearly from the Kigali lot. Every single athlete out there realized the fact that if they got sick, okay, this is not only a 14 to 21 day sickness. This could go on to 2-3 years, depending on how incapacitated it makes one. And the reality is that their contracts with clubs overseas would be cancelled with immediate effect if they put themselves into a position where they got sick. So they were very disciplined in this light. And that is something that I believe the South African government must start outlaying very, very quickly, is how to discipline somebody and let them understand that this disease will kill them. Okay. And by doing just basic, simply set up by taking consideration, you feel sick, stay away from people. All right. We're in the flu season. Everybody's got the snivels. Everybody's got a headache here and there, body aches. These are all symptoms of the COVID. But again, if you have these symptoms, stay away. And this is what we've actually imposed upon our sportsmen and women within basketball, and it seems to be working. We've run our leagues. We've been very successful in running leagues in the first part of the year, the first quarter of the year. As soon as this variant outbreak, we stopped all leagues within the country. It's important that lives are more important in the sport right now, and we are monitoring everything. And quite simply, as soon as we see the downturn start again, we will then introduce the next phase of competition. Although our program is already drawn up and we've ensured that majority of the competition is taking place in the summer months, the winter months seem to be more of a danger period for people with COVID, where the summer months seem to kill the virus a little bit more. But at the same time as saying that, no person comes into my stadium unless they've gone through the whole process of sanitizing their shoes, sanitizing their arms, their luggage, their wheelchairs, their wheels, or anything of this nature. Okay, inside the premises is daily sanitized, whether it be by utilizing gas inside there to kill the virus, or ultraviolet light, or whatever the case may be. We ensure the highest quality possible. I know that everybody can't afford it because finances is difficult, but at the end of the day, one has to realize that once you allow somebody inside your premises that is COVID infected, you are personally responsible for their death. And that is something that people need to understand. So a lot of the competitions that are taking place right now, we're doing outdoors rather than indoors. It's a lot more safer playing basketball outdoor right now than indoors. So that's one of the resumption policies we've put in play. And the other is, again, social distancing, not allowing spectators at all, not even allowing teams that have just played their first game to stick around and watch the second game, clear them out completely. Okay. And then, of course, monitor sanitizing balls, sanitizing table equipment, sanitizing shoes, hands at all given opportunities whenever there's a break in the game. And it seems to have worked. It seems to have worked until today. Again, we're not going to test the waters during the winter month. And that is the reason why we've now taken our competition and pushed our competition to very, very late. 31st of July is supposed to be the 3-3 Commonwealth qualifiers for South Africa. And the problem that I have there is that if this variant doesn't start dropping in the next week or so, then I'll push that out until late August in hope that we will be able to be in containing it again. Okay. The cost factor to run a tournament in a bubble is extremely expensive because it's single room accommodation. It is the food that comes through is regulated. The movement between point A and point B is regulated. Every single time a person gets into a vehicle and out of a vehicle, that vehicle has to be sanitized. Every time that person enters into the stadium, there's a whole protocol that goes through with it, from temperature testing to rapid testing to basically control of every aspect that player does. So it's not just a matter of allowing sport to continue as per norm. It is difficult right now. And the competition I'm going through now to Hungary as one of the World Championship windows is also exactly in the same boat. It's not just a matter of arriving at the tournament and going sightseeing and then coming back in and participating within competition. It is in bubble from the time you begin to the time you end. And then thereafterwards, it's back into South Africa, retesting again, isolation for another 5 days. And so it goes on and on and on. Those are the realities that we're faced with. And if we can keep that same status quo here in South Africa, South African competition, we should not be suffering from this COVID virus.
Well, Charles, thank you so much for your time. I wish you and the basketball executive all the best. Let's hope, let's pray that this Delta variant does start dropping, that we start seeing some fall off, and that we can start getting some of the other sports going back in the country. Hopefully 31st of July doesn't get pushed out. Hopefully we're not waiting until August again for basketball to kick off. But all the best. Good luck in your travels to Hungary. And hopefully when you're back, you can give us an update on what's happening in European basketball outside of those World Championships.
Absolutely. Thank you once again, Mark. Much appreciated for getting us out in the public there. And to all those out there, take care of yourselves.
Thanks again, Charles. Bye-bye.